I'm Amanda. I'm one of the Assistant Directors of Nursing at South London and Maudsley. And the presentation today is going to be much more focused on my experience as a ward manager, which was a couple of years ago, but still very relevant. So in terms of improving quality, we have a number of drivers, as you're all very familiar with. We've got the Quality Network for Forensic Services and the accreditation for inpatient mental health services, led by the Royal College of Psychiatrists. Productive mental health ward. We have rolled out productive mental health ward across all 64 of our inpatient services, and we've seen some really positive outcomes from that. All the work that goes on in the CQC, harm-free care. We were part of the pilot in London in mental health for harm-free care. It was originally an acute trust initiative. Essence of care, we all know about Essence of Care. Star wards, obviously you just heard from Marion, and that was definitely an influential factor in a lot of the work that I did as a ward manager and subsequent in a more strategic rollout across the organisation. And then we've got the Chief Nursing Officer's vision and strategy for nursing, building a culture of compassion, which has just been launched. We developed a questionnaire and we asked all the women on the ward to give us their feedback. And not surprising, these are the themes that came up. So not getting enough time with staff, wanting to be more involved in decision making. Big thing was around information, not just information for patients on the unit, but also for carers. Bored, there's nothing to do. That's a regular theme that comes up. And this was one of the themes that came up that we were quite surprised with, and it was around sleep and not being able to get enough sleep due to various reasons, based on illness, but also based on the environment. So that was our baseline data, but what we also did was we carried out a momentary time sample, which we did over a period of a week, and every hour we would monitor the location, where patients were on the ward, what they were doing, who they were engaged with. And this really just gave us the opportunity to have a greater understanding about the environment and where the most, how busy different areas in the environment were. The types of activities that people were engaged with, whether it was group activities, whether it was one-to-one activities, and then who the patients were actually engaged with. And non-surprising, what was previously said, it came out that often they spend a lot of time with fellow patients, or alone, or with unqualified staff. And this was what we focused on. So we wanted to involve carers more and have better access to friends and family for the women on the ward. We wanted to relieve boredom. We wanted to provide information, but not just provide it all in one go, provide it at the right time throughout the admission process. We wanted patients to be able to get a good night's sleep, obviously, and we wanted to keep people safe. So those were the 5 key areas we focused to improve. And we did it through the use of PDSA, which I'm sure you're all familiar with, particularly in productive mental health ward. So it's Plan, Do, Study, Act, and the purpose of using the PDSA was really to systematically involve everybody within the team in the improvement that we wanted to make, but also to regularly evaluate it and then make further improvements. So the first area we looked at was involving carers. And the first point of call was to develop a carer questionnaire and find out from carers what the issues were for them, really. And what came back from that was actually, 1, access to staff when they needed access to staff, and 2, not having enough information. So what we did with that, we developed some carers packs, and this consisted of a bundle of information which would go out when the patient was admitted to the ward. We'd send out to the carer a bundle of information, obviously with consent, and it would include a letter from me as the ward manager, welcoming that carer to the ward and providing them with contact details to get in touch with me. What we also seen as a huge gap was young carers information. I think it's still a huge gap in mental health at the moment. Obviously we were looking after all women, and a lot of these women had children. The children often cared for their mum at some point in time, and they were often neglected in terms of being involved in carer support from staff. So we came across this information pack from Bernardo's, and you do have to pay for it, but we did get some funding to buy this, and it was a brilliant resource, not just for the young carers but also for staff to support young carers.